Welcome to the Society of Enoch Weekly News for July 18th, 2015, our health and longevity show. Today I'd like to begin by talking about a recent discovery. I think most of you are already aware that DARPA a few years ago developed an infrared light device that stimulates rapid healing. Recent news reports another tool that can be used to aid in stimulating the acceleration of natural healing processes. British Dr. Mark Bass, a lead author of a study being conducted jointly by teams at the University of Sheffield and the University of Bristol in Great Britain, says that the research team has demonstrated that the application of ultrasound waves to a wound speeds up healing by 30% in mice. Using ultrasound wakes up the cells and stimulates a normal healing process, says Dr. Bass. This process has particular application on wound healing issues common to the elderly and diabetics, where wound healing often takes an extended period of time, and so this would speed up the process. Clinical trials on human wounds are showing similar results. And there'll be links for this and every other topic, and a transcript that I'm following, and all the links will be in the description. So check that. If any of this interests you, check it out down below. Check out the links down below, and you can read the articles and find additional information. So the next topic is a new healing gel. Any of you that have ever used spray-on bandages and had to deal with the mess and relative ineffectiveness of them will be interested to learn that bioengineers at Brigham and Women's Hospital in Boston have developed a wound healing hydrogel. The hydrogel, composed of tiny polypeptide chains, mimics the elasticity of skin tissue when sprayed on an open wound and then activated by light. It acts as a sealant, sticking to the tissue at the site of the injury, creating a barrier over the wound and sealing in the wound. As the gel is exposed to light, its molecules bind together to create a mechanical stability that can stretch more than the tissue in the body. So they can spray this on an open wound, expose it to light, and it turns immediately or very quickly into something that's very similar to skin in its texture and its protective ability over a wound. The gel is consumed over time by naturally occurring enzymes and had no toxic effects on living cells in lab experiments. The gel contains silica nanoparticles, which give it the ability to effectively prevent bleeding. So it can provide protection of a wound and stop bleeding with a single treatment. If you've ever used a spray-on bandage, like on a skin knee or something, you got to wait till it stops bleeding before you can spray it on. This stuff you would put right on. You just basically dab off the blood that's there and spray it on, and it would seal the wound pretty much immediately. At least that's what I understand from this. Preclinical studies are going to be required to test the gel's properties and safety before human trials will be possible. So it may be a little while before we see this on the market, but this is a pretty cool thing, and hopefully it will be available OTC so that we can use it in our homes, but we'll just have to wait and see. Any of you who are cycling enthusiasts may have noticed that Chris Froome, a leading cyclist, had something in his nose at this year's Tour de France. He was wearing a specially designed stent called the turbine, which is designed to facilitate better breathing through the nose. According to its creators, Rhinomed, the turbine allows about 38% more air through an athlete's nose. Rhinomed spokespersons told reporters, essentially by reducing the resistance in your airway, you can get more air for less energy. So I guess the general idea is if you're involved in heavy activity, heavy physical activity, competitive or arduous, this allows you to, by opening up your nostrils and holding them open, it allows you to get more air in with less diaphragm movement, less working to breathe and getting more oxygen in and more being able to exhale more too, I assume. But so that's something you may want to check into if you're into athletics, or highly aerobic athletics, where a little extra edge would be of use. So and an exciting bit of news that, or at least personally exciting, something I have been wanting to see come into public access, it's been worked on from several angles, is the ability to grow new teeth. There's a Dr. Jeremy Mao, a professor of dental medicine at Columbia University Medical Center. He has just unveiled a technique that directs the body's stem cells into a scaffolding that will aid in the regeneration of a new tooth. Although dental implants are currently available, the healing process can take months on end, and the implants that fail to align properly with the ever-growing jawbone tend to fall out. So you could go through this huge process to get a fake tooth implanted in your jawbone, and then your jawbone grows and the tooth falls out. And the healing recovery time from getting that implanted is several months. This new method involves a growth factor infused three-dimensional scaffold, and if this interests any of you, check on the link below because they have pictures and stuff, more information about it. A three-dimensional scaffold with the potential to regenerate an anatomically correct tooth in just 9 weeks from implantation. By using a procedure developed in the university's Tissue Engineering and Regenerative Medicine Laboratory, Dr. Mao can direct the body's own stem cells towards the scaffold, which is made of natural materials. Once the stem cells have colonized the scaffold, a tooth can grow in the socket and merge with the surrounding tissue. So we're talking about growing a new real tooth, an anatomically correct tooth, one that's connected in all the ways that it should be. Dr. Mao's technique is the first to achieve regeneration of anatomically correct teeth by using the body's own resources. Factor in the factor recovery time and the comparatively natural process of regrowth as opposed to implantation, and you have a massively appealing dental treatment. So if you're missing some teeth like I am, I'm missing quite a few teeth. I've had a health condition that's caused me to develop abscesses over the years in my teeth. They get impacted, or not impacted, but I've gotten abscess. There's a name for it. Anyway, I've had to have several of my teeth removed. And so this is something that's of particular interest to me. Next up, chronic fatigue cure. Chronic fatigue syndrome first entered the medical lexicon in 1988 to describe a cluster of symptoms without an obvious cause that doctors were seeing originally in the Lake Tahoe area of Nevada. The principal symptom was debilitating tiredness, but people also complained of sore throats, headaches, muscle pain, and various other manifestations of general malaise. Researchers in Norway have been trialing a drug used to knock out white blood cells in people with lymphoma and rheumatoid arthritis, both of which the white blood cells, cause problems. Like in the rheumatoid arthritis, the white blood cells attack the cartilage. So anyway, 2/3 of the people who took this drug for the treatment of lymphoma or rheumatoid arthritis experienced major remission of chronic fatigue symptoms, essentially returning to normal life with bursts of vitality unthinkable while they were ill. Those who suffer from chronic fatigue syndrome or who know someone who does will want to check out the link below so that the sufferer can talk to their doctor about it. This is, since it's in, I don't know, it's in clinical trials now, or it's being used as, no, it's in clinical trials in Norway for use on lymphoma and rheumatoid arthritis. So it's probably not available yet, but this is a development that their doctors will want to look at, because this treatment points to the underlying cause, which has been a mystery up to now, of chronic fatigue syndrome. So there may be currently available treatments that may offer more relief to chronic fatigue syndrome sufferers until this is available. Anyway, recently in June, the FDA met with researchers to consider a clinical trial that treats aging as a disease. Physician Nir Barzilai of the Albert Einstein College of Medicine in New York says, what we want to show is that if we delay aging, that's the best way to delay many types of disease. Barzilai and the other researchers, I should have taken some time to practice pronouncing this guy's name. Barzilai and other researchers are planning a clinical trial called Targeting Aging with Metformin, or TAME. They will give the drug metformin to thousands of people who already have one or two of three conditions: cancer, heart disease, or cognitive impairment, or are at risk of them. Metformin is already used to treat people with type 2 diabetes. The way they discovered this potential anti-aging effects was the participants, I guess I should just stick to my script. The participants will then be monitored to see whether the medication forestalls the illness they do not already have, as well as diabetes and death. Matt Kaberlein at the University of Washington in Seattle, who is running a trial of rapamycin in elderly dogs, which is a drug that has been shown to reverse many of the aging processes in mice, and says the concept behind Barzilai's trial is sound. Even though other drugs might be more effective at delaying aging in animal studies, rapamycin being one of those drugs that in animals has been demonstrated to significantly impact to delay the aging process. He says many years of experience with metformin in people, in other words, it's a drug that people have been using for a lot of years, combined with data that suggests it impacts the aging process in people, make it a good candidate for a first clinical trial in the field. FDA-approved clinical trials are an important step towards the development and deployment of treatment specifically for aging. So, yeah, check the links below. Researchers at Weill Cornell Medical College report that they have found that reactivating a single gene was enough to stop and reverse colorectal cancer in mice. With a return to normal intestinal function within just 4 days, and the tumors being gone within 2 weeks. Nearly 700,000 people around the world die from colorectal cancer annually, which makes it one of the top killer cancers. Researchers treating mice with colorectal cancer found that not only did the tumors stop growing, but also the intestinal cells recovered normal function. The tumors shrank and disappeared or turned into normal tissue within 2 weeks. After 6 months of monitoring, the equivalent of about 25 people years, the mice remained cancer-free. This form of cancer is the third biggest killer cancer among the human population, and this form of treatment has many desirable characteristics over traditional treatment, including a much higher success rate. The method may have broader application in developing treatment for many other types of cancer as well. There's still a lot of research that must be completed before human clinical trials may begin, but this development bears watching. This is, colorectal cancer is a big deal, and this may be like more than a cure. Reversing cancerous cells into healthy cells and having the body stimulating the body to naturally cure itself of cancer, to me that's pretty exciting. Okay, next up, a team of investigators at Massachusetts General Hospital have made strides towards the development of bio-artificial replacement limbs suitable for transplantation. In other words, they have successfully grown rat limbs, rat legs and arms, or whatever they are, that are suitable for transplantation. In their report, which has been published online in the Journal of Biomaterials, the researchers describe using an experimental approach previously used to build bio-artificial organs to engineer rat forelimbs, front legs, with functioning vascular and muscle tissue. They also provided evidence that the same approach could be applied to the limbs of primates. So that's, a big step towards being able to grow new hands, new fingers, new arms for people that can be transplanted on if you were born without one. Yeah, if you're born without arms, we can grow your own arms for you. That would be pretty cool. They have shown that they can maintain the matrix of all these tissues, muscle, bone, and cartilage, blood vessels, tendons, ligaments, and nerves, in their natural relationships to one another. That's been one of the big issues with growing organs, is like they've been able to 3D print kidneys for mice, but 3D printing them on a larger scale, they can print the kidney cells, but integrating the capillaries and the nerves that would be in the mix is something that they haven't been able to do with 3D printing yet. So being able to grow organs or now limbs is going to change a lot of things. Okay, anyway, in their natural relation, they can culture the entire construct over prolonged periods of time. So it's not an overnight thing. It takes time, but they can grow a new thing. That we can repopulate the vascular system and musculature. So the author notes that more than 1.5 million individuals in the U.S. have lost a limb, and although prosthetic technology has greatly advanced, the devices still have many limitations in terms of both function and appearance. They had used decellularization technique to regenerate kidneys, livers, hearts, and lungs from animal models, but this is the first reported use to engineer complex tissues of a bio-artificial limb. So that's kind of exciting news. And I'm afraid that's all I've got ready for today. I was hoping to talk a bit about water, but I guess I'll have to save that for next month's Health and Longevity show. Thank you for watching, and tune in again next week.